in Twitter land and Facebook. My name is Graeme Reed, part of the Canadian Spondylitis Association, here as part of the Arthritis broadcast network at the CRA-AHPA Joint Scientific Meeting in beautiful Victoria. I'm here with my friend and colleague, Hsin Yen Liu, a third-year medical student at the Western University studying under Dr. Janet Pope. We're very excited to be here together on our first interview on the Arthritis Broadcast Network. I was wondering if you could share a little bit about yourself, your research, and your relation to rheumatology.
Sure, yeah, thank you for having me. So my name is Hsin Yen. I'm a third-year medical student at Western. Thank you for the introduction. Basically, I became involved in rheumatology and after first year of medical school, where I did a clinical studentship under the direction of Dr. Janet Pope at Western University. And since then, I've been involved in research, kind of looking into the guidelines for screening for antimalarial, particularly hydroxychloroquine-induced ocular or eye toxicities. Mm-hmm.
That's great. And I hear you're presenting a poster here at the scientific meeting. Could you explain a little bit about that poster?
Sure, yeah. So kind of as a background information, hydroxychloroquine, or the brand name is called Plaquenil, that's a medication that's commonly used in patients who have lupus, rheumatoid arthritis, and many forms of peripheral arthritis as well. And it's a relatively safe drug that works pretty well in a lot of patients and with very few side effects. But one of the serious adverse events is it has potential of causing some ocular or eye toxicities after a patient has used it for a long time. And so because of that, we would need to make sure that we screen patients appropriately for these potential complications before the patient's vision is actually affected. So what happens is that there are some tests that we can do that can detect changes at the back of the eye before the patient has any signs of visual symptoms. And so if we catch any abnormalities in that period, then we can stop the medication appropriately before any real toxicities or kind of noticeable toxicity is apparent to the patient.
Very cool. And is that part of continuing research? And what would be maybe the next step in your research after presenting here?
Mm-hmm, yeah, so for this particular poster, we basically looked at different guidelines for the screening tests as well as the frequency used in detecting these ocular toxicities. And the next step, I'm actually in the middle of doing a project looking at kind of the rate of follow-up for patients who are under Dr. Janet Pope's practice. So looking at how frequently people are actually getting their eye exams, kind of what kind of eye exams people are getting, as well as the rate of toxicities and whether there's any risk factors that we can identify for developing these kind of toxicities.
Very cool. We're excited to see where that goes, obviously. I'm going to just switch gears slightly and ask a little bit about your clinical studentship with the CRA, and I wonder if you could explain that for folks on the line, and also ask about what were your most memorable points, and then what were maybe the most challenging points.
Sure, yeah. So the CRA studentship, it's a summer program provided to Canadian medical students who are interested in rheumatology. And it basically allows you to do like a 4 to 12-week placement that either focuses on a clinical experience in rheumatology or doing research in rheumatology. And for myself, I did the clinical program after the summer or during the summer after my first year of medical school. And during that clinical experience, it was a very enjoyable experience where I really got to learn how to take a proper physical and history when it comes to patients who have different kinds of rheumatic conditions. And the mentors that I've had, Dr. Pope and other rheumatologists there, they're also very excellent teachers who kind of taught me how to do joint injections as well as doing both formal and informal teachings.
Very cool. And did you experience any challenges in that process?
Mm-hmm. So there are definitely a lot of challenges that I encountered during that process. I did it right after the first year of medical school, meaning that I barely had any kind of clinical experience to begin with. But the program was pretty supportive and kind of making sure that it was a good experience for me. So one thing that was really helpful was that in the first week or two, I mostly just observed other staff and other residents during those clinical encounters, so have a better idea and understanding of kind of what a typical encounters looks like, as well as the key things to make sure that you cover during each appointment. Another thing that I found really challenging was particularly with patients who have fibromyalgia, and I found it really challenging just because we still don't really have great medical therapy for fibromyalgia, so a lot of times it felt helpless not being able to prescribe a drug for those patients. Yeah, but I think it was really helpful to see my mentor's approaches to these kind of scenarios where they don't necessarily focus on all the medicine or like all the medical therapies, but rather on kind of lifestyle changes and other modalities for treating the condition.
Yeah, that's a great little plug for our different organizations as we get involved with the patient side of things and all the non-pharmacological treatment that patients require to help support living well. I wonder if you could share any advice or tips that you have for students who might be interested in not only maybe the CRA studentship, but maybe also rheumatology writ large.
Yeah, so I'm also a student who's interested in rheumatology, so I would actually appreciate advice from myself.
That's great, yeah.
But in terms of advice to, I guess, even younger students, my advice is to just get involved as much as possible, because through my both clinical and research involvements that I've had so far, I've learned so much that I wouldn't have imagined learning before getting involved. In particular, just doing the research on Plaquenil or the hydroxychloroquine toxicity really helped me understand what the role of a rheumatologist is. Part of the project involved me kind of flipping through every patient's charts and their correspondences with the rheumatologist to see what kind of tests they have done and kind of what went through or what happened during each visit. And that experience really helped me kind of understand kind of the amount of work and what kind of work the rheumatologist does for the patient, and kind of the importance that a rheumatologist can play, or the important role that a rheumatologist can play in the patient's life.
Very cool. And obviously you're interested in rheumatology. What would be for you the next steps in pursuing that interest, recognizing that I guess you're in third year now?
Yeah, so
what comes next?
There's still quite a long journey ahead of me. So I'm still in my third year of medical school, meaning that I haven't even done my medicine rotation yet. So that's next for me. And then after that, I have my fourth year of medical school, where I finish my electives, and then eventually, if I do end up in the rheumatology route, then it's 3 years of internal medicine residency, and then 2 additional years of training that's specifically in rheumatology.
Very cool. And we know from the arthritis perspective, we always need more rheumatologists, so we definitely encourage you to do that. The kind of question that I have that might be relevant for the overarching CRA topic is a new decade in rheumatology, and recognizing that you're early into this phase. I wonder if you want to share any thoughts on what you see in kind of the future of arthritis and research and care.
Yeah, so I think the treatments for different kinds of rheumatic diseases have really revolutionized in the past 2 decades or so, where we have the introduction of many kinds of different biologics. And so it's been, I think, about 2 decades since the first biologic came out, and throughout the past, I guess, 10 and 20 years, we've had so many other biologics and different classes of biologics that became available. And so personally, I think in the next decade, it will be interesting to see kind of whether we have long-term data that's available for these biologics that can help us choose between the different biologics, and maybe even a entirely new class of medications that becomes available.
Wicked. What a great vision for the next 10 years. I wonder if we have any questions from our audience. Anita, do you?
What was the most interesting thing you found in your research? What was the most interesting finding?
Most interesting finding. So I think the most interesting was kind of how the guidelines have revolved over time as we understand more and more about the epidemiology, or kind of how the hydroxychloroquine retinopathy presents. So back in the days, there were some guidelines that recommended no systematic screening because it's irreversible. But recently, guidelines are advocating for routine screening, especially after 5 years, because even though the damage is irreversible, if you can catch it early enough, then you can prevent further damage from happening and prevent any kind of actual visual changes to the patient. So it's interesting to see how things have changed over the years because of better understanding into kind of the pathophysiology and kind of the screening tests that are available.
And did the age factor affect the eye toxicity you were researching?
The age factor?
Yeah, like did you notice a difference with patients at different age group?
So from my own experience, we didn't really find a correlation between age and the development of toxicities. Okay. But sometimes people who are more elderly, they might have baseline eye conditions like macular degeneration or glaucoma that might make it a little bit more difficult to screen for these toxicities.
Very cool. I think that's it from me, but we're very excited to see you in rheumatology, recognizing that it's, several years. I think maybe in the next decade we'll have you on the show again when you are a rheumatologist, and then we can hear from your research. So with that, thank you, and stay tuned.
Thank you.